Okay, so this is Meg again. We're going to go over possible complications when you're doing a blood draw. Everything from not being able to find the patient to nicking an artery. So we're going to go over what the possible complications are and how to handle that situation. The first problem or possible complication is a problem in site selection. Sometimes if they have occluded and sclerosed veins, you're unable to draw from them because they're basically not, the blood is not flowing. They can be caused by inflammation, disease, prolonged IV therapy, chemotherapy, or repeated venipunctures where you have a lot of scar tissue. And then hematomas, or basically a bruise, is where you have the needle that went all the way through the vein, having the bevel half in the vein, or failing to apply enough pressure after withdrawal. Other problems in site selection include edematous tissue, which is swelling, arm swelling due to fluid accumulation, because it's going to make all of the veins and or vessels almost squeeze too tight to get any blood out of them. Burn scars and tattoos, they impair circulation and it's susceptible to infection. And then mastectomies, where they remove the lymph tissue, causing lymphostasis or a lack of lymph fluid movement and increased infection rates. So you're unable to draw that from those areas as well. You also want to make sure you do not draw blood from an arm with an IV in place, if at all possible. If there's absolutely positively no other site available, make sure to draw from a site distal to the IV, which means below the IV, okay? You always want to make sure, if you can help it, you do not draw blood from an arm with an IV in place. Another possible complication is difficulty finding a vein. Some more techniques that'll help. Using a blood pressure cuff, which will obviously squeeze the area and cut off blood flow, which will make blood pool in the veins. Place 3 to 4 inches above the site and inflate to a pressure above the diastolic but below systolic reading. And then use a site other than the antecubital in the arm. Use the hand, foot, leg, anywhere you can find a decent vein. Some problems associated with tourniquet application. A tourniquet is what you're going to put on to stop the flow of blood so that you can find the vein. Hemoconcentration, which means you leave the tourniquet on in place for more than a minute or too long. Formation of petechiae, which can be caused by excessive bleeding if the tourniquet is applied. Petechiae is little vessel breaks. If the tourniquet is applied too tight, and obviously if people have a latex allergy, you want to use a non-latex tourniquet and bandages. For the most part, you're going to be using non-latex tourniquets and bandages everywhere you go because the risk of latex reactions is too great these days. So some complications during collection would be syncope, which is fainting. Can occur quickly. So you always want to make sure you ask the patient if they have a problem with blood draws or seeing blood or seeing needles, anything like that. So you always want to communicate with your patient. Make sure to draw blood in a recumbent position so that they're basically laying down or laying back. Don't turn your back on the patient. So if you turn your back, they could pass out and fall out of the chair or wherever they are. And then you want to make sure that you or someone stays with the patient 15 minutes after, depending on how much blood you've taken. There's some tests that require 10 plus tubes of blood, and that can add up quickly and make patients lightheaded. Other complications include hematomas, which is like bruises, blood leaking into the surrounding tissues. Petechiae, which are small red hemorrhagic spots appearing on the patient's skin. This indicates that a minute amount of blood has leaked into the skin epithelium. And then excessive bleeding. Obviously, if a patient's on a blood thinner or they have issues with coagulating or clotting their blood. They may have excessive bleeding. More complications would be hemoconcentration. It happens when the tourniquet is applied. It's a decrease in the plasma volume with an increase in concentration of cells and molecules. It can be caused, as I said, by prolonged tourniquet application, massaging, squeezing, or probing a site. There's also hemolysis, which happens when red blood cells burst and hemoglobin is released, and the serum, which is normally straw colored, becomes tinged with pink or white. Additional complications is seizures. I actually had a patient who she was laying down, but she failed to tell me that she passes out and seizes every time she has her blood drawn. So this is where I learned to communicate better, because it was one of my first IVs that I tried to put in, or blood draws. I'm not sure it was an IV or a blood draw, but regardless, she passed out and seized, and I had to remove the tourniquet and remove the needle immediately. So make sure you're always in communication with your patient and just asking them if they have ever had any side effects to blood collection, or any sort of have any sort of fears of any kind, because people can get sick and pass out and seize and all of these different things, and you don't want that to happen if possible. Nausea and vomiting. You want to make the patients comfortable and make sure they have an emesis basin, which will have, and you'll learn all about. Emesis is vomit, so it's a vomit basin. Instruct the patient to breathe slowly and deeply, usually in through the nose, out through the mouth, so they can control their breathing, especially if they're anxious. Pain, obviously, you're sticking a needle through the skin. So you want to prevent the startle reflex by informing the patient there'll be a little poke, big poke, whatever kind of poke you want to say. Just make sure they know you're about to poke them. And then a hematoma, which is blood in the surrounding tissues. Additional complications during collection: lack of blood flow. Obviously, if you miss the vein, you're not going to have blood flow. Also, when you're collecting blood, the tubes have vacuums. If you have a defective tube, the vacuum is not going to work. You're going to be unable to actually suck the blood up into the tube. So you always want to make sure that your tubes, that you're checking the tube as well. And then improperly positioned needle. The bevel can be stuck to the vein wall. It can pass through both sides of the vein. It cannot be advanced far enough, so it's just in the tissue, not in the vein, or you can just miss the vein completely. All of these things are going to happen to you at one time or another. These are some pictures of improperly positioned needles so that you know what it looks like. More complications during collection: a collapse vein. If the vein is too small and you're using too much vacuum, when you're pulling out the blood, the vein can collapse and you won't be able to get any blood out of it at all. Inadvertent puncture of the artery produces bright red blood and may cause spurting or pulsating of blood into the tube. And then failure to collect on a first try. Now, everywhere you work, it's going to have a policy and procedure explaining what to do if you poke someone. You can only poke someone a certain number of times. The normal procedure would be the second try is most of the time acceptable. However, you're going to use a new needle and tube, obviously. You're going to go below the previous site or use the other arm. You're never going to go into the same site, and you're usually never going to use the same arm unless you absolutely positively have to, and I would still get permission to do so. Problems in completing your procedure. One of the biggest problems is going to be prolonged bleeding. Most draw sites should stop bleeding within about 5 minutes. If someone is taking an anticoagulant for blood clots, it can take a little bit longer. But you want to make sure that you apply pressure until the bleeding has stopped. Obviously, if the bleeding continues for like a seriously long amount of time, you're going to want to call someone. But most of the time, it's going to stop within 5 minutes. Some long-term complications associated with venipuncture: iatrogenic anemia, which is anemia caused by excessive removal of blood. Um, if for some reason you hit an artery and the patient bleeds excessively, they're going to have a lot of their iron or hemoglobin taken out because of all the blood loss. So they may develop anemia until they're able to regain that iron storage. Compartment syndrome is also another long-term complication, where a large amount of blood in the surrounding tissues is there and it prevents blood from flowing freely into the vessels. It can cause a lot of pain, swelling, and then permanent risk to other nerves and tissues because they are so compacted in by all the fluid. Some other long-term complications would be nerve damage. If they come in contact with a needle during collection, your patient is going to know it, and they're going to let you know it because it's going to hurt. It's going to send wherever that nerve stems from, it's going to send a shooting pain all the way through the area of the body. And depending on how much you actually puncture the nerve can be damaged permanently. So just make sure that you are not going too deep no matter where you are performing the venipuncture. Also, of course, infection caused by improper aseptic technique before and during collection. You always want to make sure you're wearing gloves. You always want to make sure you're using an alcohol swab to make sure that you're properly cleansing the area. You also want to make sure that you use a fresh piece of gauze and a fresh Band-Aid over the site to make sure that no bacteria is forming. So this has been our possible complications. So please, if you guys have any questions, let us know. There will be a short quiz on this as well. So you'll be taking that soon, and good luck.